He's worked in renal unit of Naval Hospital in Athens, in intensive care unit of Hospital of Chest Diseases in Athens, and in respiratory unit of Manchester Royal Infirmary in England. He has been a member of Faculty of Homeopathy in England and of Hellenic Homeopathy Association in Greece. He has practiced in England for 10 years, combining Ayurveda and modern medicine. He is involved in ongoing research in the field of psychosomatic diseases and stress management through Ayurveda. He participates in international conferences and has given lectures in UK, Ireland, Germany, France, Switzerland, Japan and India, promoting modern and scientific view to Ayurveda.
Sarve bhavantu sukhina, sarve santu niramaya, sarve bhadrani pasyantu, ma kaschi dukkha bhave. Om Shanti, Shanti, Shanti. Thank you for your invitation. I'd really like to talk about a very practical aspect of integrated medicine. I was working in Manchester Royal Infirmary in England, and I was going to start a PhD in asthma. I had met my friend and really teacher in Ayurveda, Dr. Barot, many years ago in Greece when he gave a lecture in Ayurveda. And I think this is how my globalization of Ayurveda started. I traveled to London. I'm a medical doctor, so I really wanted to know that Ayurveda is working. I very quietly asked him to allow me to be for a month in his practice, and I was amazed. I've seen that really nearly all his patients were getting better in a mysterious way that I did not know of. And this really prompted me to later ask him if he can teach me Ayurveda. So I decided to leave my PhD in asthma and all the letters and the employments by a pharmaceutical company, and to say, please teach me Ayurveda, and I would like to know more about it. And this is how the integration started in reality in 1989. So when we're talking about integrated medicine and Ayurveda, we have to see what are the needs of the West. Why do we need another medical system that is more holistic than our modern medicine? And I have here the first really slide. We have more side effects. We don't have really treatments for chronic diseases. The cost of new drugs is very high. And really that is why in the West we want a more holistic system. This is the need Ayurveda has to serve, really, if it is to be globalized. And here it is from a work by, Professor Bhushan Patwardhan, comparing Ayurveda and the traditional Chinese medicine. Western scientific community views traditional medicines cautiously and stress the concerns related to research, development and quality. So I know when we are here, we all love Ayurveda, but in the West, there is a doubt. What is Ayurveda? Is there research about it? Is it safe? What is the quality of it? And this is what we have to really face. And again, in the same work of Professor Patwardhan, there is a comparison between the research published in Chinese medicine. PubMed, there are 10,278 papers on Chinese medicine and only 1,045 in Ayurveda. And I'm not going to tell you all these numbers, but just have a brief look at them and see how we need to progress if we want to persuade the scientific world that Ayurveda is worthwhile spreading. Allow me to move to the next slide. The type of research we do with Vaidya Barot is linking really traditional slokas in Ayurveda and totally modern research in the frontiers of modern medicine. You all know Vastaka, and we know that in Ayurveda, the first quality of the drugs of Ausadam is what we call rasa. And I was always thinking that why did they choose rasa as a first quality? In modern medicine we are choosing chemical qualities. Is it anti-inflammatory? Is it an antibiotic? Why on there do they choose rasa? And you know, if you put a medication in a capsule and you avoid tasting the herb in the tongue, does it change its ability? And here, Vasaga is a bronchodilator. And see what happened. Now this has been published in 4th of November 2010, really a few days ago in Nature Medicine. And you can see here bitter treats for better breathing. And allow me to make it very simple for you. A new study in mice and human tissue shows that in our airways we have bitter taste receptors, something unheard of. Up to now we thought that taste receptors exist only on the tongue and nowhere else. And these bitter taste receptors, they have an action to relax the airway smooth mass. Agonists of these receptors seem to be better than current beta-2-adrenergic bronchodilators in a mouse asthma model. It sounds too technical, but it's of amazing significance for Ayurveda. I believe personally that if they found bitter taste receptors in the lungs, probably there are different taste receptors everywhere in the body, and that is why in Ayurveda I believe they go on about rasa and bitter taste and all these things. And really our intuitive idea as Vimbarod, as he guides me, is to open the old slokas, look into these slokas, and then go to totally modern medicine and put these two things together. I'll give you one more example. We always say that asthma is a kapha vikruti disease. But in modern medicine, we simply say asthma is a spasm in smooth muscles. Again, this is published in the American Journal of Respiratory and Clinical Care Medicine in September 2010. And they found that there are metabolic abnormalities independent of weight linked to asthma. And they say that if you have a tendency to have insulin resistance, if you have high triglycerides, then you have more tendency to have asthma. Really, they give evidence to what in Ayurveda you say that asthma is a kapha disorder in a kapha organ. And this type of research we needed to really give modern evidence for Ayurveda. And again from Professor Patwardhan, there is need for research. I have highlighted in red here that controlled clinical trials are important to develop evidence for safety and efficacy. This is what the West needs. If you say I'll use anything, they say, is it efficient? Is it safe? Then only we are willing to give time, because you know, time is money, time is everything in the West. You cannot just waste time to study Ayurveda and propagate it. To have a holistic approach of Ayurveda, we have to go again to genomics, compare Prakriti without genomics, and really start analyzing our herbs in a much more holistic way. Why we give churnas, why don't we have just what we call a single target metabolic drug effect, and we have multi-targeted sites. These are very important issues. And really, finishing my PowerPoint presentation, I want to say that we have a holistic health center in Greece, and we really believe it is a model of this type of integrated medical practice. And I would like to show you a small video.
Oh, Josh, you can come and sit down.
He's one of my patients.
So how is life?
High executive person in Greece.
How better? Good trip in the States? Tired? Tired. Okay, let's have a look at your pulse. Seven?
Well, basically I'm an executive in a company. The hours are nevertheless very, very stressful. This usually has had in the past a very negative effect on my migraine headache.
So, George, if you compare how things have been in '97, when we first met in October, what percent would you say things are better now?
I would say I had in '97 about an average of 4 to 5 headaches a week. Now, I would say we have, over 90% success. Well, natural medication, in cooperation with a little bit of yoga exercises and relaxation. really seems to be the answer for me.
This patient who talks about his migraines was coming to see me in London, in our clinic in London. And he would tell me that when he got the migraine, he really wanted to commit suicide, to jump out of the window. He's a member of a very rich family in Greece, and he has been to nearly all the famous neurologists around the world. He's a very good friend nowadays, but when we are talking improving patients through Ayurveda, he improved so much. When this film has taken place, he was willing to come and give an interview against medical confidentiality, to give his name and say how much he was benefiting from Ayurveda. This is the type of improvement we want to see in patients, this type of dramatic improvement. Vigil and help for society. We often visit India with Vaidyas and
plantation. Help for the whole planet is not something different. It will follow when everybody follows one's own natural rhythm.
This is how Holistic Health Center is in a rainy day. We don't have too many days of rain in Greece, luckily. This is the garden and the view from my window. Now, because of my work, a lot of people have called me on TV to give an interview. He said, talk to me about holistic medicine. And I gently put the word Ayurveda in it. I'm talking to him about Yastimadu and Tulsi and all these things. He got so fascinated that then he said, please come and give an interview on Ayurveda itself. And he invited me again on the panel to give him an interview on Ayurveda.
Ινδική ιατρική, αυτό που έχουμε μάθει να λέμε Ayurveda.
Ayurveda, he pronounced the word Ayurveda.
Είναι ο κύριος Νίκος Κωστόπουλος, ιατρός, εξειδικευμένος στην Ayurveda.
It is in Greek, so it will sound all Greek to you, but let me give you something very simple. The questions I was asked were about efficacy of Ayurveda. He will bluntly ask me, what can you do for this and that disease? What is it possible to be done? And really, this is what they ask you when you are in the West. They are not just in love with you. They say, what can you do for our patients? This is what they really want to know about it. I explained to him about terms of Ayurveda and all these things. I made him a Sanskrit scholar, so at the end he asked me to finish the film in Sanskrit. He says, can you please, when the TV film finishes, finish it yourself in a Sanskrit verse. So I make him slightly fall in love with Ayurveda. I explained to him the definition of health. He's laughing, he doesn't know what Sanskrit is.
Μιλούν για τάκη που είναι ιστή. Δεν σου λένε πρέπει να είσαι στο σωστό σύστημα, στο υπερβολικό λιπόδιστο. Αλλά ξέρεις τι λένε μετά.
There is interest as well.
Ευχαριστώ για την πρόσκλησή σας, Πύρο.
Να φιλοξενούμε στο πλατό μας τον Dr. Νίκο Κωστόπουλο.
Ευχαριστώ πολύ για την πρόσκλησή σας.
Εμείς ευχαριστούμε που ήρθατε.
Και επειδή σε εκτιμώ ιδιαίτερα, γι' αυτό είμαι εδώ.
Ευχαριστώ πάρα πολύ. Είναι την παρέα μας στην Πρακτικά του Μπράτσο. Γιατί να ασχολήσουμε με την Ayurveda. Είναι η ειδικότητά σας. Έχετε σπουδάσει στην Εθνική Σχολή του Πανεπιστημίου Αθηνών και μετά αναξοπιστήσατε, να το πω εντός εισαγωγικών.
It tells me that I changed religion. I moved from modern medicine to Ayurveda. And why have I done this? Now, in our center, we conduct seminars with Vaidyas and Parot. This is for international participants. And you can have a short view of this. There is an answer for everything. If you smoke, do not worry at all, you get a lung transplant. If you smoke, you need steak 3 times a day and your heart gets stopped, don't worry again. Heart lung transplant. So we try to increase what we call the awareness about Ayurveda in the West. We teach them yoga, very practical. You can see them here doing Kapalabhati. You can hear their effort to breathe in and out properly. And you can see by the Azimbar they are teaching them. I do the same thing for Greek, but here on the wall you'll see the paper about Ayurgenomics in modern medicine. And I'm as passionate as I'm here, as you can see.
Είμαι λίγο φανατικός. Λέω αυτό είναι λίγο έτσι, αλλά αυτό δεν είναι πολύ ψηλά. Λέω γιατί είναι σπαστρία.
This is the holistic healthcare again.
Έχεις πιο πολύ πίτα.
You can see there is a wide audience there interested in Ayurveda.
Αλλά εντάξει, είναι φυσιολογικό. Δεν είναι κανένα τρόπο. Πήγαινε σπίτι σου. Αυτό είναι που ψάχνεις πολλές φορές. Εντάξει.
And we are doing research. We are doing research. We have done research with big institutions. One is the Miami University. This is with the Department of Dermatology and Cutaneous Surgery. This was applying an Ayurvedic herbal cream on second-degree burns in a porcine model. We've done it in 2003. And it was with excellent results. This is the faculty. If you know Dr. Professor Eaglestein and Merz, they are very high names in this research, and Holistic Health Center has sponsored and really moved on this research with extremely good results. And these results were sent in this paper together with Professor Jain, who is in the BHU. He is the head of plastic surgery department. This was presented in Montpellier. It was the 3rd International Scar Club meeting with the title "Seeing is Believing, Amazing Results with a Herbal Preparation for Hypertrophic Scars." And it was received very, very well there again. And this is what I say, we need to do research. We try to do it in a small scale in the Holistic Health Center. And now, when we are teaching, we try to teach influential people. I'll show you 2 interviews, and I'll let you listen to what they are saying about Ayurveda.
Hello, my name is Dr. David Ratzi, and I am a consultant physician with a special interest in homeopathy, working in the UK. I've been practicing homeopathy for the last 31 years, and I've been studying Ayurveda under Drs. and Nicholas Kostopoulos for the last 25 years. I use the knowledge and discipline from Ayurveda to enhance my homeopathic prescribing. And there are 4 areas of special importance for me. The first is the concept of the constitution, and from that derive the understanding of Prakriti and Vikriti. As a medical student at St Bartholomew's Hospital in London, I remember asking my professor of medicine to explain the differences between healthy and sick people. I did not get an answer then, and indeed never got an answer until I came to Ayurveda. I have found this knowledge very useful in both assessing the need for and the subsequent effectiveness of treatment regimes. The second very useful concept is the discipline of Ahara, Vihara, Aushadha.
You can see
This gives responsibility to the patient for their own health and well-being. Any of you who have practiced in the West will understand just how revolutionary this is to patients, and will know how reluctant some people are to take this step. The epidemic of type 2 diabetes currently sweeping the West is largely related to obesity and mostly responds very well to significant weight loss, a testimony to this rather sad fact. The third important concept is the understanding of the close relationship between body and mind. and how each may affect the other. Western medicine tends to put them in separate boxes, which inevitably makes it much more difficult to treat the patient as a whole person. Essential if one hopes to obtain a cure. The fourth and last concept is the way in which the knowledge contained in Ayurveda extends into every area of life. For example, Desha, Kala, Rutu.
Can you see? This is called expanding Ayurveda
This
in the West.
controls and brings harmony to the lives of both physician
An eminent
and
physician
patient,
learns about Desha and Kala
thereby
and
helping
Rutu and
them
Vayu.
to lead a happy, healthy life, free from disease and pain. I hope you enjoy the study of Ayurveda as much as I do, and find good use for it, both in your practice and in your life.
So, when we say Ayurveda awareness, this is what we mean in Holistic Health Center. You have to teach people, but you have to teach them in the right way. Look at this man
I'm
here.
the director of pain medicine.
Another student of Holistic Health Center.
Dublin, Ireland. This is a university teaching hospital of Trinity College. The university was founded in 1592. The medical school celebrates its 300th anniversary in 2011. I am also the first elected Dean of the new Faculty of Pain Medicine at the College of Anaesthetists of Ireland. Persistent pain affects on average 13 to 20% of the population of Europe. People with chronic pain make an average of nearly 7 to 10 visits to their doctor per year. Chronic pain costs billions of euros, perhaps as much as 300 billion euro across the EU per year. We believe that persistent pain is a disease in its own right and a major healthcare problem. There is an urgent need for better treatments and understanding. Through the guidance of Vedya Ashwin Parakh in London and Dr. Nicholas Kostopoulos in Athens, I have been introduced to the principles of Ayurveda. I genuinely believe that it can help further the understanding of this modern silent epidemic of chronic pain and holds the potential for some new treatments through its concept of Vata disease, Vata Vyadhi. We can offer a more integrated approach to the problem of chronic pain, considering the constitution or genetics of the patient and how his whole lifestyle affects his health and disease.
And this is, yes, this will be the end of our presentation. But remember, we said in the beginning, integrative medicine. This man, this doctor at the end, Dr. Power Camillus, he is the Dean of Faculty of Pain in Ireland. There are only 3 faculties in the world. And through his attending our awareness programs in Ayurveda, he says that, listen, I believe Ayurveda can help in a more integrated way. This is what we call awareness programs. We should influence really people who are in the medical profession, together with eminent people, to spread the word of Ayurveda in the West. So clinical practice, research, awareness, this is the model we believe in. And I say all these things not out of ego for us, because you can say with the grace of God everything happened. I really want to encourage all of you to believe a little more in Ayurveda, to believe that we are human beings with unlimited potential. Open your wings and spread Ayurveda in the right way. Thank you.